Hi, welcome to Straight Talk. Today, we're going to talk about a couple issues that are affecting our underserved populations when it comes to health issues. Specifically, we're going to talk about women in childbirth, and we're also going to be talking about prostate cancer. Very big concerns in our minority communities, certainly here in Baltimore. So I was looking at some of the numbers that we're talking about when we talk about childbirth and pregnancy. And it's very scary because it's a serious issue when a woman is pregnant, and we want to make sure everything's good and everything works fine when we talk about giving birth. And it can be serious. But for African American women, it's even more serious. They're 3 to 4 times more likely than a white woman to die due to pregnancy complications. That's unbelievable. In this day and age, it's unbelievable. And in Baltimore, less than half of pregnant women even receive prenatal care. Mm-hmm. Now, to me, that's something it's just unbelievable. So we've invited, and she's been gracious enough to come on with us, Tarnisha Hemphill, who's a certified nurse midwife at the Mercy Medical Center, and she's an assistant professor at George Washington University. And she's going to help us understand the concerns, the issues that go on, the problems, and also what do we need to do about it to solve it. Welcome to the show, Tarnisha.
Oh, thank you so much for having me.
It blows you away when you look at the fact that less than half of pregnant women in Baltimore get prenatal care. That's something that you don't even think about not getting, that it isn't happening. It must concern you a great deal to see some of this. So first of all, we're going to get into all this. You're a certified nurse midwife. What is that?
Yes, I am. I absolutely love what I do. A certified nurse midwife is a nurse who went back for an additional degree as a master's in midwifery, and I am able to provide care, mainly low-risk care to pregnant patients. We are able to see them not pregnant, so from teens to menopause is what we always say, so through their whole lifespan. And so we provide GYN care and we provide OB care. We work with a great team of obstetricians as well, if we need some assistance as far as like surgeries. But other than that, we're able to provide low-risk care. We provide a lot of education, a lot of nurturing, a lot of one-on-one support. And we love being a part of their births and helping them, bring in a child into this world, or help them with any kind of issues that they may have that's specific to their needs.
So the midwife is a special training that you receive in addition to being a certified nurse.
Yes, it's a credentialing, it's an exam that we need to take in order to be able to practice as a midwife.
Very impressive. That's great.
Thank you.
People may not even know that. That's the thing. So let's get into this issue of pregnancy and childbirth with minorities. The numbers just are staggering when you talk about, we don't want to see any woman have problems with their childbirth. But when you start looking at some of the complications that we're seeing for minorities, then it really means we got to do better than we're doing. Talk a little bit about, what are the issues that we see, like what are the inequities that we see that you have to deal with every day?
Yes, I agree. The numbers are alarming. Many people don't realize that some people do not receive prenatal care. Some of the inequities or reasons behind that is rooted in systemic racism. Some is due to socioeconomic issues, or maybe just lack of. Also having any barriers to getting access to healthcare. Chronic stress. Actually, a lot of people of color, women experience a lot of chronic stress, and that impacts whether they're able to even obtain or continue to sustain prenatal care. So it's multifaceted. It is very complex, the reasons behind these numbers.
You think about availability and whether or not, they can get to the service, whether they can be consistent with the services, because I'm sure you probably provide all kinds of prenatal care workshops, seminars that you're willing to see them. But is is that transportation an issue?
Yes, so there are several barriers actually. Transportation is one of them. And if it's not just as far as being able to take a bus or an Uber, it could also be an issue with paying for parking at certain locations. And for some, financially, that may not seem like a lot, but it is a lot for others. Childcare, being able to have someone watch their kids and feel comfortable with that. Some people are in neighborhoods where they don't feel so safe to leave out to come and get prenatal care. Some people have to pay copays, or it's a lack of insurance and they're concerned about that, or not educated in knowing how to obtain insurance for that. And so once they have one barrier up, then there appears to be other barriers, and then they don't receive prenatal care, or they have a hard time continuing to get prenatal care. It's also about whether they've made a connection with their provider. If they feel like their provider don't see them or hear them, then they won't continue. If they've had any kind of trauma, let's just say, or a bad experience before receiving prenatal care, they may not feel comfortable going back again to continue prenatal care. So, it's a lot of different factors. A lot of people want to blame the patient, but they have to also take a step back and think of any other reasons that may be as to why people are not receiving prenatal care, because many people want to receive it. But like I said before, there's just so many barriers and so many reasons and obstacles they have to come across before they can even receive one prenatal visit.
Yeah, I mean, I've been in the drug abuse field for a long time, and
Mm-hmm.
same thing there for women in general, being able to get their child care, all
Mm-hmm.
the things that you brought up are definitely barriers that are real. You
Yep.
know, they're very, very real. And so, it just, it's just
And another
yeah.
barrier is mental health, just depression is another reason why people don't receive prenatal care. Sometimes it's hard for people just get up out of bed in the morning while they're battling depression or battling a loss of some sort. And so just trying to think of all those things and find ways to encourage people to still come in and receive prenatal care, it can be quite difficult at times.
And here they are pregnant. So,
Yes.
and next thing you know, they look up and 2 months has gone by,
Mm-hmm. Yes.
4 months, and 6 months,
Mm-hmm.
and do you see much of that? You brought up something that really interests me. But we talk a lot about postpartum depression after. What about that process you're talking about, which is during being pregnant? What
Yep.
that can do, whether to a woman uh, just feeling something growing inside, and
Mm-hmm.
while it's a wonderful experience, it
Mm-hmm.
they may feel depressed, huh?
Yeah. So, it's a wonderful experience. It could also be anxiety provoking, or it could be, a little bit of depression if they feel like they weren't prepared or not ready for this stage in their life. And they're just trying to figure out how to add that into their life. What is their new normal? And so we just encourage them to come to prenatal care so we can help them navigate that and acknowledge their depression or acknowledge their anxiety, or just sometimes just the unknown can be, a little anxiety provoking. And so we just always say, just come and get prenatal care. Come and get to understand and learn your provider. And, we can just kind of help you navigate this. So that was another barrier. Some people just feel like it's just too much.
Yeah, yeah.
Yeah.
What in your professional opinion, what is when we talk about prenatal care,
Mhm.
what would be like the ideal situation for a woman who's pregnant? Uh, what does that mean to get prenatal care? Is it weekly, monthly? How do you look at that?
Great question. So usually they start around 6 to 10 weeks would be their first initial visit, where they get to meet their provider if they have not established with one before. And they will learn about what to expect in their pregnancy. And then they will come every 3 to 4 weeks until they're around 7 months pregnant. And then they will attend prenatal care every 2 weeks until they're around 9 months pregnant, and then every week. Some things are changed based off of any pre-existing conditions. So if they have any other health-related issues like diabetes or high blood pressure, depending on their age, they may be seen more frequently. Or if everything is kind of low risk, they may be seen a little less frequently. But that is pretty much what's expected. During those prenatal visits, blood work is done. Different testing is done, ultrasounds are offered, and just a lot of education is being done. A lot of services are being provided. And so it's just important to be able to come in, and we do it frequently because it's kind of hard to learn everything at one visit. So we spread it out and make it pertinent to what's going on in that particular part of your gestational age. And we try to make it fun.
And you're also going to be able to spot complications.
Yep. And the
What are
key
some of
is
those
this,
complications you see at the beginning that you
so
might pick up?
I'm sorry. So the key is to spot these, like early identification of any kind of concern. So it could be diabetes, it could be hypertension or preeclampsia. Preeclampsia is high blood pressure during pregnancy. Any kind of heart conditions or severe anemia. We also are focusing on the baby and making sure the baby is growing appropriately. And so all of these visits are looking at to see if there's anything that we can intervene early to help get a positive outcome for mom and baby.
Yeah, that's the important thing, is be able to spot those things that they may not actually see. And but we should make, we need to have this for everyone for free, so they don't, so there's no barrier to keep away from it. But your advice obviously here is to prenatal care is important. If you have questions, call. We're talking with Tarnisha Hemphill, certified nurse midwife at Mercy Medical Center, which we all love. I love it to death. And assistant professor at George Washington University. And she's been giving us some good tips on what we need to do and how we can help women have a good pregnancy and a good childbirth. And that's what we want. We want everyone happy and healthy. Tanisha, thank you so much for this information. I feel like I could talk with you all day. Really know your
Thank you so
stuff.
much. Thank you for having me.
Sure. Thanks for being on.